Hello, and welcome to Voices in African Health. This is the podcast where we explore the big questions shaping global health and connect them to realities across Africa's health systems, hearing directly from the people driving change. I'm your host, Sharon Quntai. Joining us today is Vivianne Ihekwezea, Managing Director of Nigeria Health Watch, which is a leading health communication and advocacy organization. So Vivianne, welcome to the Voices in African Health podcast. It's wonderful to have you here with us today. To start us off, could you first start with introducing yourself? Tell our listeners, first of all, a bit about yourself and your work at the Nigeria Health Watch.
Yeah, hello. Really pleasure to be here. As mentioned, my name is Vivianne Ihekwezea. I am the Managing Director of Nigeria Health Watch. Nigeria Health Watch, we are a health communications and advocacy organization, primarily based in Abuja, Nigeria. The work we do is focused, yes, very much on Nigeria, but increasingly over the last couple of years, we've expanded a lot of our communications work and our engagement with organizations, both regionally in Africa, but also globally in the global North countries. So really pleasure and honor to be at this very important podcast today.
Absolutely. Thank you so much for that introduction, Vivianne. And basically, I wanted our listeners to also understand that this is a conversation that we are having after the World Health Summit, whereby Vivianne was speaking in one of the really important sessions where we're talking about strengthening trust in health information. So Vivianne, could you tell us a little bit about why you think strengthening trust in health information has become such an important issue across Africa today?
Okay, I think the importance of trust in health information has always been an important issue. This is talking about the very basics of explaining to people, ordinary citizens who don't have a medical or technical background, the importance about health, just basic, everyday, rudimentary health issues. And I think in recent years, the way that communication is done has evolved. Because if we think about health information, traditionally, the main communicators or people who spoke about health were the people who you meet at the front lines, your medical doctors, nurses, midwives, etc. But increasingly, the way health information is communicated has very much changed. And there have been many catalysts that have led to that change, which I'm sure we will go into as we progress in this podcast. But what we have seen evolve are the people who are now communicating information has evolved and changed. And that in itself is a good thing, but that in itself has integrated and introduced some inherent risks in the quality of information and in the type of information that's communicated. So I would say these are some of the catalysts that have really changed the way changed the way health information is communicated and the importance of communicating health information.
Absolutely. And that's such a great foundation for a conversation. Thank you for giving us a recap. At the World Health Summit, one of the strongest themes from the session was that we are not lacking information, but we rather lack trust. And that was such an interesting observation. From your perspective, what do you think has changed in the way that people engage with health information today specifically?
Okay, I think the critical word you mentioned was trust. So I'll go back and explain why I mentioned trust. As I said when I started, the communicators of health information has changed over the past few years. It used to be your doctor, your nurse, etc., the frontline workers who typically communicated health information. So those were the people who people trusted because of their medical background. So if a doctor tells you to do a certain thing, you know they're doing it because they have the foundational knowledge to inform. But as we have seen, the evolution of who are the messengers has changed significantly. One of the catalysts for that significant change we're seeing and the absence we're now seeing of trust is the proliferation of digital platforms that we have. If we think back 20, 30 years ago, the main platforms we had for communicating any type of information were the traditional TV, radio, newspaper, etc. Those were controlled mediums, and those had a wide reach. So television, it entered in people's homes globally, newspapers, you read, radio, similar thing. But with the proliferation of media platforms, and I'm talking now about social media, which has really catalyst in this diffusion of information from Twitter, Facebook, etc. I won't list all of them because we know what platforms we're talking about. What they did in a way is they democratized access to information. So it no longer meant you listening to the news to get information or buying a newspaper or switching the radio on. Social media, our digital platforms were there 24 hours a day. And those people communicating could be anybody now. So anybody who had a Twitter account, Facebook, etc., could communicate information. But the challenge we now have with those is, who are those people communicating? And when we are now seeing the multiple platforms people can get information from, that does now lead to the question of, who do we trust? So that, I think, is what has now introduced that question of who are the people who are communicating trusted quality health information to people. And that are the inherent risks we now see in how people access health information specifically.
Absolutely. And that's very interesting, actually, because indeed, I agree. Technology is really changing how people are accessing health information right now, to the extent that people are actually making decisions based on the information that they can find on social media, on different digital platforms. People are making decisions about their health overall. And we're even seeing a lot of people now. One of the examples is that a lot of people now are even using AI. They're going to AI, open AI, to ask questions about their health, to get diagnosis about, different health issues that they have. So that's an interesting take, that this is an observation that you have. Maybe do you want to speak a little bit about the Nature Commission and the work that you're doing with the Nature Commission, specifically on getting trusted and quality health information, before we go into the next question?
Yes, it's very good that you mentioned the Nature Medicine Commission, because it's a 2-year commission looking at access to quality health information. And the catalyst really for the Nature Medicine Commission was, because Nature, this is probably one of the first kind of specific commissions they've done around health, around quality health information. It's the first one they're doing around quality health information. And is really understanding, how are we accessing, or how are people accessing health information? And, when we think about what does it actually mean when we say quality health information, the definition that we've come up with in the Nature Medicine Commission of what is quality health information is, we say, quality health information is health information that's scientifically sound, emphasis on scientifically sound, as in it's grounded in evidence. It's accessible, so anybody can access the information. It's clear and essential to enable people to make quality and important decisions. So this 2-year commission that started last year is really focusing on looking across the different platforms people have access to information, the different ways people are consuming information. How are we going to safeguard and ensure that when people access health information, it is quality? And quality means it is trusted, it is evidence-based, it is scientifically sound. Because we know what happens when people are not accessing quality health information. I'll give you a very, very quick example, just to kind of buttress that point. We have an Ebola outbreak currently. But thinking back, I remember in Nigeria how people were listening to stories on how you can prevent yourself from getting Ebola. And some of them were things that were actually very, very dangerous. So one of them was by swallowing salt solutions. So we know what that can do. But people were not sure of what to do. So a lot of this misinformation led to people making unsafe decisions about their health. And we see that again repeated in COVID-19, et cetera, et cetera, et cetera. So we realize that we really have to understand, how are we going to ensure, as much as is possible, how can people access quality of information? What are some of those barriers? And what are those challenges that actually impact people's access to the health information? And who are the people who are helping to ensure that people access health information? So really, this 2-year Nature Medicine Commission, when we complete it, we hope that by the end of it, that we're able to better understand what are those things that need to be done. How can we advise, different media platforms? Just how can we generally guide or inform the way health information is now produced and how it's now disseminated? So we really hope that this Nature Medicine Commission will really spotlight a lot of those issues and ensure that, we're promoting what we say, access to equitable quality of information from trusted sources, and make sure that we also maintain that public trust in health communications more than anything.
Absolutely. Is there a specific platform which our listeners can probably look into to be able to see this information from the findings and the research that you did as Nature Commission?
Yeah, the Nature Medicine Commission is ongoing and it will be completed in 2027, next year. So we're still in the first stage. We have different working groups that are working across the different aspects of this. One of them, for instance, the one I'm focusing on is looking at what we call legacy media. So looking at our traditional media sources, media platforms I mentioned, TV, radio, print, etc. And also looking at how that has now evolved to digital platforms. And there's another group that's looking at coming up with an index of sorts. How can we measure what exactly quality health information means? So this 2-year Nature Medicine Commission on Quality Health Information, the commission will complete its work and the report by end of 2027, or at least by 2027.
That sounds great. And I think that's very important work that you're doing. And just to take you back a little bit to the World Health Summit and specifically the session that you're speaking on getting trusted health information, one of the strongest themes from these sessions was that AI and digital tools are being used a lot, but AI specifically needs to be in local languages and local context. That really stuck with me. And I think this is something that's coming up a lot now in conversations around AI overall in Africa, that it needs to be tailored to Africans, for Africans, so that we are able to understand how to even interact with the information that we are getting. Why is it so important, according to you? Why is it so important for Africa specifically to tailor AI to our own use? And what risks do you think we face if that doesn't happen?
Okay, so thanks for that. If we ask or we think to how AI is able to generate information, basically, as we know, what AI does. I mean, before AI tools, when I say AI tools, let me be specific. Let me just mention two. Let's think Claude and let's think ChatGPT. Before these two platforms, we had things like before Google, there were others. I think back to there was a platform called Ask Jeeves, which really were the early stages of really using search engines to generate information. So, with Ask Jeeves that came before Google, and there were many others, you just basically enter a query. And what that does, it now scrapes and goes through the internet and pulls out that information and shares the distillable, it provides you that information that you need. That has now evolved to artificial intelligence, which is a similar thing. But what an AI tool do, ChatGPT, Claude, etc., it literally generates its information from looking across every published piece of information you can access, reading it very, very quickly, and now giving you back that information in very easy, digestible formats. And that's really, I think, revolutionized people's access to information. But now going back to those data sources, if we are saying that the data sources that the information is pulled from, it's not specific to our context on the continent. It's not specific to our own individual customs, cultures, needs, etc. Then we are saying that the information that we're being given is not being tailored to our needs, which is why you will heard this phrase repeated endlessly, that data is the new oil. And when we say data is the new oil, it means that it's in a very, very important resource. We never look at data as a resource, but the people who have access to data are the ones often in a very strong negotiating or very powerful, in a powerful position. So where does AI and where do these AI platforms get their information? It generates information from looking across across the internet, looking at scraping different sites and really pulling that information and now condensing it into a way that anybody can access. So if we say to ourselves that as a continent, the information sources are not specific to our own context, our own needs, we are not the ones who are generating this information. So that just means that the information that we're getting, it's not tailored to our needs, to our own language. In Nigeria as it is, we have over 200 languages. So if you are going to enter or use a search engine to generate information, it's not going to come up in Igbo or Yoruba or Hausa. It's going to come up in the language that most of the information on the internet is framed in, French, etc. So when we say that as a continent, we have to play a bigger role, I know that there are some organizations in Nigeria, for example. There's an organization called Data Science for Nigeria that has a chatbot. And it provides young people with information on sexual reproductive health. And we know that many young people use slang often in the way they speak. So if they want to ask a question to this search and to this chat box, they will often try to frame it in English, and then the response they may get is framed in a way that, yes, it's very much English, but how are they able to use their own local slangs to ask those questions that the chatbot feeds them back that information, understanding the local context and understanding what that slang means. And they've been able to program it to basically understand local terms. So I think this really is the way forwards in how we do the way AI tools are generating information. So are we able to also, from our own different country perspectives, be it in Swahili, be it in Zulu, be it in Xhosa, how are we able to use our own local languages to train these models? Because the way the models are trained is specific to different contexts. So if you're able to train a model in Swahili, so anybody in Kenya or Tanzania is able to use it to generate information. And if your first language is not English, your first language is, Setswana or anything else, then that tool is now tailored to your context. So I think this is an area that we can do better in. And as a continent, knowing the diversity of our populations and knowing the importance of, as I mentioned, the Nature Medicine Commission, access. To enable that equitable access, we have to make sure that the models are trained on our own local languages and understanding our own local context, because that's what you now say is quality for the people who are receiving the information.
Exactly. Yeah, absolutely. I mean, I think that's great, and I absolutely agree, because also when it comes to health, I think there's a risk if AI is not tailored to our languages and our needs, and considering how much people are consuming, especially health information through AI, then there's the risk of getting wrong information that could in turn bring about a lot of risks. So right now you find that even a lot of people are even interacting about, their health information. They're interacting with AI before even seeing a nurse, a doctor, going to a healthcare facility. So I absolutely agree that tailoring AI into our own languages and into our own needs, I think that would really make a whole difference. And of course, this is more common now because access to information now is really easy with the digital world. Digital penetration in Africa right now is we are really, I think even in the most rural areas right now, you would find that people do have mobile phones, people do have access to mobile data, and they can be able to access information. So I believe that this is a good time that we are having this discussion. And I just wonder, how do you think then in this case, how do you think public health institutions should respond to this shift where people are now using AI more, using digital more to access their health information? How do you think the public health institutions should respond to this?
Yeah, I think, what is very important is that public health institutions, especially in the way they disseminate information, they have to remain agile. And when I say agile, it means they have to change and evolve the way the way their target audiences are changing and evolving. So it's also about understanding people access information. Where they access information from? And when they access information, how they're using that information. We have to be clear on segmenting who we mean by target population. So the way an 18-year-old consumes information is different from the way a 50-year-old consumes information and the way an 80-year-old consumes information. I'm using these different demographics specifically because I'm thinking, for instance, of myself. From how my child and how my mother consumes information is completely different. So public health institutions have to be clear on who they're targeting and knowing what platforms those people use. So, for example, an 18-year-old, an 18 to 24-year-olds, they are not going and reading newspapers or watching television or listening to the radio in the way, for example, an 80-year-old or a 50-year-old may be doing. What we are clearly seeing is younger demographics, especially, are going straight to digital platforms. So social media platforms have really, really changed the way news content is disseminated. So 18 to 24-year-olds, specifically, let's think as a demographic, they are not reading newspapers. They are going straight to Instagram. They're going straight to TikTok. They're going straight to Snapchat. So even platforms traditionally that we all were introduced to as social media platforms, Facebook, those younger generations are not using those as much. And like, yes, it does differ where you are. So for instance, in Nigeria, people still very much use Facebook and other African countries, whereas, in Europe and the US, platforms like Instagram and TikTok and Snapchat are much more widely used by this younger demographic. So public health institutions need to be really, really clear on where these different audiences are. And as an example of how this has evolved, and when I say public health institutions need to be agile, nature itself has recently joined TikTok. Historically, nature, we all know, well-respected platform that generates, research, publishes research. They have now opened a TikTok account because they're very conscious of how young people, especially 18 to 40-year-olds, are accessing information. Many of them are going straight to digital tools, social media. So they are changing and evolving in the way they disseminate health information. And I think in the same way, public health institutions need to also evolve, change, adapt the platforms they use to disseminate health information.
Right, absolutely. And it is very true. I understand completely about especially the younger demographic and how they're consuming information right now. Just thinking about the concern of misinformation, and this is something that was coming up a lot also during the discussion and the session at the World Health Summit. I think I noted that there was also a deeper issue that came up around representation and credibility. So do you think specifically that African voices are still underrepresented, especially in the global health conversations?
So the question you're asking is, are African voices well represented in a lot of these global discussions around health, especially? So there's, okay, so a couple of things. So first of all, I will start by saying many global seminars or summits, etc., have improved increasingly on how African voices are represented in panel sessions, in side events, etc., etc. There has been a marked improvement in ensuring that representation is there. So, World Health Summit in Berlin, I have to say that because World Health Summit itself as a platform, because the one we went to is the regional one in Nairobi, and they do regional ones in different places. So the main World Health Summit, I have seen the evolution of delegates, and I've also seen the evolution in speakers. So increasingly, I have noticed the diversity of speakers has improved significantly. When we say global health is literally everybody. So it's not just hearing voices from the global north or the global south as we term them. I know these terminologies, we're still battling whether we're comfortable with them, but just for the sake, we'll use it. So when I say global north, I mean Europe, the USA, etc. How are those voices represented? We often see them guiding a lot of discussions, but also what we saw in Nairobi, which was what was so amazing about the session in Nairobi, is we saw so many African health experts sharing work that is done on the continent, because we don't often spotlight the work we are doing on the continent. So we often come across as if we are learning from what the global north is doing and then we now implement it locally. Actually, we see that we ourselves have developed a lot of that expertise in responding to all of our health challenges and how we even address a lot of our health challenges. So we need to continue to find similar platforms. So I know next year AMREF are doing the AHEC conference. WHS in Nairobi was fantastic. The Conference on Public Health in Africa, which is taking place later on this year, is another platform. So we need to continue to grow our regional platforms where we have these discussions, but also add to that where we have African experts speaking at these global platforms is also really important, because that's where we now are able to spotlight what we're doing, but are also able to be part of a bigger conversation that we now hear mentioned, which is the global health architecture. So how and who is going to now lead this new global health architecture, and who is going to inform the direction it takes? I think that has to be a collective change where African voices are part of shaping what this new global health architecture will look like, because it has to be inclusive and it has to factor in our voices and it has to factor in our perspectives, because that's the only way we can ensure the representation from the continent actually happens.
I think just it would be important also to discuss, like you mentioned, about how we were talking about tailoring AI to our own needs. I think also something else that I'm spotting is that there is that really deep need for authenticity. So people are trusting information that feels familiar and feels relatable. And people tend to also listen to voices that they recognize and stories that they can really reflect and connect with their own experiences. This has actually been coming up a lot in our work with the media, whereby media interviews specifically regarding African issues there's that need for having African spokespeople specifically talk about African issues. So Africans really talking about African issues for that authenticity. How do you think we can balance scientific accuracy with communication that actually resonates with these communities?
When we talk about scientifically sound information, we have to go back to the very concept of what is the purpose of communication, is to get information across from one person to the other in a language, in a format, etc., that they can easily understand. And we know that during the COVID-19 pandemic, we were given advisories from public health institutions, from the WHO, on what to do to stay safe. And that information was often informed by evidence that they had at that particular time. And with the evolution of this new pandemic, that we obviously was something that changed, that was evolving and changing, the scientific advisories changed as more information was available. And we often heard people saying, oh, yesterday the Public Health Institute said we should do this. Today they're saying something different. It's not that they were saying something different per se. What was happening was science was informing the response, but as the scientific knowledge evolved, as more information was available, that advisory was updated. So it wasn't like the previous advisory was wrong. It was just that they have more information now to give you better advice. So that, for me, showed clearly that people lacked an understanding of how scientific information evolves, and it's not a static thing. So really, to get people's trust, that as a baseline has to be understood. The scientific advice and guidelines and science evolves and changes as more is made available. So we have to get that as a baseline clearly understood. But people have to also understand and trust in science. When we hear public health experts provide guidelines or information, that information is premised on their knowledge, on their expertise. What we now have, which is where the danger of misinformation and disinformation comes in that the people who are now disseminating information, you don't often know what the basis on which that information is being made. And that now leads to distrust and confusion and not knowing who to turn to. So we know in communities, etc., specifically in communities, in many communities that we come from, we live in, the people who often tend to be trusted are, your health workers, your community leaders, your religious leaders, your traditional leaders. They are very important custodians of that trust. So when we do, for instance, as an organization, Nigeria Health Watch, a lot of our community engagement, we often speak to, the imams, the priests, the traditional leaders, because they are the ones that the communities trust and listen to. We know for various reasons that trust in government, depending on what country you come from, is not always there. So people often think, who can I and who do I trust? And when we now add in the part of having to disseminate scientific information, it gets complex. So when we are communicating, we have to remember two things. When we communicate in scientific information, we have to make it as simplified as possible and take away the use of jargon so people can understand it. But then also, how do we make sure that we are using trusted community sources to disseminate that information? Because the messenger is also as important as the message that's being disseminated. So I think when we now think of, scientific information and dissemination, we have to think first of how we're communicating it, how we're simplifying the science, but also who is communicating that information.
That's very interesting. And I'm just wondering, you've mentioned how you think mostly people should evolve and move with the times. I wonder do you think there's something that you would say, a role that maybe you'd say African governments and probably also health institutions should also prioritize if we want to rebuild trust in health information?
Yeah, I think in terms of the rebuilding trust, it's a lot more complex than that, because it's not just African governments that have this challenge of trust in health information. And I'll explain to you why I say that. Where we have countries that people don't trust the government, that speaks to what I would term the social contract that is existing between the government and the population. That social contract means, what is it that the government is providing, and what is it that the citizens expect from their governments. So, for instance, in many African countries where people have not historically seen the government respond to their needs, so be it, you have an issue, your child is sick, you go to health facilities, there are no doctors, they're not being paid, or your child is not able to go to school because the schools are not working. And so you have to yourself pay out of pocket for healthcare, or the schools your children go to are not optimum, or the roads are not fixed. Then if you as an individual, as a community, feel you have to do everything yourself and government is not present, then the question has to be, then why would you now suddenly trust the government when they now tell you to do something, if that social contract has not been fulfilled? Whereas you look at other countries where there is a social safety net. So during the COVID-19 pandemic, many countries, when people were losing jobs or people were furloughed, there was some protection for them to enable them to still survive. So there is an existing social contract, because that social contract also is informed by what citizens give and what they get back. So when I say give, where you have a society where people pay taxes and those taxes are now used to provide services, then you have, as a citizen, you're able to now hold the government accountable to deliver services for paying taxes. But where we have societies or structures where the tax base is low, you're not paying taxes, and the government, for instance, a country like Nigeria, where a lot of our revenue is generated by oil, then the government doesn't really feel accountable to the public. So suddenly, if the government is now telling you to do something, why would you trust them? Because if you have an issue, the government has been present. So we know that to really rebuild trust, and for governments to build that trust, they have to think about the social contract that they have with their citizens. What do I owe my citizens? What should I be delivering? And how do I make sure I fulfill on that promise to be there for them when I need? So that when I now ask something of them, they now respond because I have fulfilled what they feel is my duty to them. So for them, to build trust, these are one of the things that needs to be done. And of course, it's far more complex, and I've explained it. But these are some of the things, and these are some of the reasons why there may be distrust. And of course, it's not that it's a perfect situation in many global North countries, because even in those societies, we saw with the COVID-19 pandemic, a lot of distrust around the response. A lot of it due to the politicization of the response, but really thinking carefully about how different societies are able to build trust in their citizens, because you can look at the Asian countries and how people responded. It was also very different. So this is actually a very interesting discipline to study how societies respond to governments, and what is it that it takes to build trust between citizens and governments.
Absolutely. That's very powerful. And I absolutely agree that it will take a lot to get to the point where now, especially in Africa, based on where I live, for example, in Kenya, it would take a lot before citizens actually trust what the government asks them to do. I think that's a really important point. And I just wonder whether you feel like you have anything else that you would like to add, anything else that maybe a call to action that you would probably put out there for either be it governments or health institutions, or generally for the audience.
Okay, I think in closing, and what I think is quite important about, for instance, the Nature Medicine Commission, because it's the first one I think that Nature is doing, we must not underestimate the importance of communication. We often find in the field of work that we do, for instance, the Nigeria Health Watch, that communication is something that's often an afterthought. So, for example, when we talk about, let's say, we want people to take vaccines. So suddenly we're asking, why is there such a low uptake of vaccines? Why are people not accepting it? In Nigeria recently had the rollout of the HPV vaccine for girls between 9 and 14. And we had a very good response. I think initially when the vaccine was being introduced in Nigeria, there were questions, are people going to be skeptical? Because many countries are challenged with the uptake, because we're wondering why we're suddenly vaccinating girls between 9 and 14. But I think one of the things we learned in the dissemination of the HPV vaccine is very early on, before the introduction of the vaccine, we had very important and powerful champions who were already informing people about why our girls should be vaccinated. And these people included, our first ladies, community leaders. So they got ahead of the introduction. So before the vaccine even came out, they were already communicating about it. So that when it now came, it was easy to say, oh yes, I heard about this, and I know this is important because it will protect my daughter. So we must never underestimate the importance of communications. I just came from the Global Health Security that took place in Kuala Lumpur, and it focused very much on global health security, on biosecurity, etc., etc. But one thing I noticed that was not as much mentioned was the importance of communication in a lot of the work that's been doing. So we held a session really talking about the importance of building a workforce of health communicators. And we saw with COVID-19 how communications are such an important part of the response. So one thing I will leave and say, back to the question you asked, public health institutions, ministries of health, etc., must center communications in everything they do if they're going to build the confidence and trust of their populations.
Absolutely. And thank you so much, Vivianne, for even taking your time today to join us and for sharing such powerful insights on such an important discussion. I think we can close at this point. And to our listeners, thank you for listening to the Voices in African Health podcast. Be sure to follow us on Podbean, Spotify, or Apple Podcasts so that you don't miss future episodes. Featuring health leaders, innovators, and change makers from across Africa is one of the key things that we do here at Voices in African Health. So be sure to stay tuned. If you have any questions, suggestions on future topics, or even comments, please feel free to reach us at africa@finpartners.com.